Pleasant day to everyone. Thank you for this opportunity to share the findings of my study. I am Maria Nornelyn Cachuela from the De La Salle University, Dasmariñas, Philippines. And also I studied and took my PhD at the University of the Philippines, Open University, where I actually completed this research. So this research is called the pandemic narratives. It's a proposed discourse analysis of messages communicating the non-pharmaceutical interventions of COVID-19 infections and its transmission. Let me share my study by giving you the introduction, the framework, the methods and procedure, the results and discussion, the summary, conclusion, implications, and recommendations. So it all started in 2020. The study was actually originated from the word of the year pandemic. As the title itself says, okay, the idea came from the clamor of everyone to understand what this pandemic is all about. So although it was an early stage, okay, people started to understand that it's a large-scale outbreak of an infectious disease. And according to Merriam-Webster and dictionary.com, the increase in the number of searches on the meaning of the word pandemic was very overwhelming. So 115,806% for Merriam-Webster and then 13,500% for dictionary.com alone. So all this gives us an idea how people are wondering or trying to understand what this is all about. Furthermore, we have to understand how it all began. So in 31st December in 2019, in China, in Wuhan, China, okay, the first report of a pneumonia-like symptom or infection was reported to the World Health Organization. Fast forward 2020, number of cases were reported, people started getting the world started detecting various cases, and even reports of deaths started to come in. Now, for that alone, governments across the globe in response have imposed strict precautionary measures, or what we call as the non-pharmaceutical interventions. These are social distancing, lockdowns, wearing a face mask, and of course hand washing, in order to save and protect the lives of their citizens, until at the time the vaccine is not yet available. So, or the hope was until the virus would subside. Consequently, in different times and in different severity, many governments are dealing with an immediate crisis. So there were border closures, restriction on travels, reallocating resources, again, to meet all the medical and needs, to prevent transmission or to lessen the impact of the crisis, health crisis. In the Philippines, what happened was there were two agencies. So the first one is we have two agencies just primarily focused on this, although there are other agencies working together with them. So we have the IATF, or the Interagency Task Force on Emerging Infectious Diseases, and of course our frontliner, which is the Department of Health. So by March 25, 2020, the Republic Act 11469, or which is called the Bayanihan to Hilaswan Act, Republic Act 11469, was actually signed, authorizing the President of the Philippines, President Rodrigo Duterte, to carry the policies on preventing the spread of COVID-19 and addressing all this health care created by the pandemic for the next 3 months. So these were the first, or the initial steps of the Philippine government. Also with that, the new normal was set on public health safety, issued by the Department of Health of the Philippines, Research Institute for Tropical Medicine, or DOHRATM. So as you can see, the illustration shows the different ways on how people can actually do their daily life or daily work with with the consciousness of staying healthy or reducing their vulnerability. Okay, so this also, or these sets of protocols or health protocols aim to reduce virus transmission and try to reduce contact with potential disease carrier, reducing the duration of the infection by establishing effective disease management mechanism, and of course, ensuring governance and accountability by putting healthy regulations and policies. So along with that, the study came up with the idea of looking into uh, the discursive formations, the socio-historical events, and the socio-cultural practices that were observed in social media on these non-pharmaceutical interventions, which are stay-at-home, social distancing, hand washing, and use of face masks throughout the duration of 3 months, which began in March 25 to June 25, 2020. The study was actually inspired by the Foucauldian discourse analysis by Michel Foucault, which suggests that discursive practices could be best answered by knowing how expressions evolved, how they were expressed by, what the social status of it is, and in which context they are used. So the central issues in the Foucauldian discourse analysis are rather what knowledge exists, how this knowledge has developed, how it is transmitted, the function of knowledge, such as the creation of subjects and the influencing of society, and of course, the effect of this knowledge on social development. So moving on, this is how I operated the study. The operational framework was actually based on the Foucauldian discourse analysis, as I've mentioned earlier, but specifically targeted on the methodological toolbox by Jagger and Meyer, which they published in 2016. So you can see how the framework flows from the discourse strands or the utterances in the text found in Facebook, the discursive events or the history of knowledge, and the discourse fragments, the NPI specifically, what discursive formations, knowledge or power emerged from there, and of course, how this evolved or what kind of social-cultural practices emerged from them. So specifically, again, this is a very synchronic study, which is cross-sectional, focused on March 25 to June 25, or it's a total of 93 days. So this is a critical qualitative research. Designed, drawn from the critical discourse analysis, but specifically on the Foucauldian discourse analysis. It's embedded in the constructivism, structuralism traditions, and it will aim to look into the countrywide perspective of the Filipinos during the said period. The comments from the Department of Health or the DOH Facebook page were used as samples for the study. And then for the sampling procedure, the study utilized the opportunistic or the emergent sampling approach. So there were 3 phases for the study. The phase 1 constituted different factors, or that determine different factors or different basic information about the discourse strands. And then the second part, or the phase 2, were the detailed analysis of the typical discourse fragments. Ideally, it aimed to look into the typicality of the discourses. And lastly, okay, on the last phase, or the phase 3, is the synoptic analysis. So in the synoptic analysis, the research looked into the opinions and sentiments that emerged, whether they were consistent in phase 1 and phase 2, the socio-historical events that allowed for the discourses, and again, the socio-cultural practices that materialized in the virtual public sphere. Continuing on this, the findings of the study revealed the following. So if if I may share my data, I have the following. So these were the types of preferred non-pharmaceutical interventions. As you can see, I highlighted here that the stay-at-home was basically the main focus of the NPIs, followed by face mask, and then Third is the social physical distancing, followed by others like hand washing, mask testing, isolation, and many other like face shield. As we are practicing in the Philippines, we're using face shields. So we also have the social historical issues associated. So it's best to understand how this discourse are, or where this discourse are coming from, or what events inspired them or triggered them. So the first two, these were the findings. So the increasing new cases, because of the numbers coming in, people started reacting and thinking how these NPIs can actually address the increasing new cases. Of course, isolation because of the lockdown, so community quarantine. Of course, there's also the NPIs as the health safety standards. There's this discussion on that. The recoveries, people getting better. Of course, sadly, there were deaths at the time. And up to now, we all see the number of cases and number of deaths. There were violators, apparently, as early as March. People who were not observing the health protocols or the health safety behaviors. And then we have the social historical context. So these were, as I've mentioned, this is one way of looking at it again. The the next data showed the perceived purpose. So looking at the discourses, the Filipinos understand that the NPIs are actually ways to prevent the transmission and the worsening of the situation. The second purpose they see is detection, and lastly is the treatment. At the time, again, this study was conducted at the early part of the pandemic, wherein there's no treatment available yet, and of course, there were no vaccines formulated. And then for the purposes and insights of the non-pharmaceutical, so we can see here, these are the purposes and how these purposes were mentioned. So they were actually, preventions were mentioned as a form of compliance to the NPIs, the non-pharmaceuticals to the NPIs. Discourses on flattening the curve was also evident, being safe, and so on. So we can see the variations or the different types of opinions shared by the Filipino public in social media. When it comes to detection, the public were talking about testing, contact tracing, transparency and accuracy of the report, and they were also looking at treatments, but at the time it was more of a wishful thinking, or it's like just really hoping that there would be cure or there would be a medicine for those who are being affected. And then these are the different NPIs, and specifically how they were uttered or expressed by the netizens, no, or the Filipinos, the Filipino netizens in the DOH Facebook page. We can see specifically the variations of stay at home and as non-pharmaceutical intervention. There are different variations of stay at home. So there's a stay at home only, there's stay at home and pray, there's stay at home and social distancing. So again, these are the different beliefs, no, expressed or shared, no, by the public. For variations on the wearing of face mask, you can see face mask with social distancing, face mask alone, and then face mask with hand washing, sanitizing, etc. Moving on. The next data shows the variations of social distancing as non-pharmaceutical intervention, similar to stay at home and also face mask or use of face mask. Social distancing was perceived to be practiced with other types of NPIs as well. So for the perspective towards the non-pharmaceutical intervention, these were the responses gathered. So one is on compliance, which is the highest. People believe that people should, or generally everyone should be compliant with the NPIs. There's also the call for support and cooperation. There were also some oppositions, like there were people questioning, there were people who are disapproving it, and there were appreciation and approval. So it's a variation generally. And then for the detailed analysis, we can see here that the data shows how people were expressing their opinions about the NPIs and how they supported these claims. Okay, so during in their discourse or in the various discourse fragments, some were just directly stating what they want to say, which is the general or which is the majority, while some used ellipses, some used emojis, some used emoticons, or they use the word please, or some used punctuation marks, and a lot more variations. So for the illustrations of the discursive practices, we can see that there were different circumstances that illustrated their practices. So one is they wanted to comply and they wanted to cooperate. Others were illustrating or sharing thoughts because of the increasing cases. Some were associated with possible solution. Some again on non-compliance and other issues that came out. So what were the sentiments of the Filipinos at the time? So the sentiments of the Filipinos based on the samples studied or analyzed in the study, where they were very supportive of the non-pharmaceutical interventions. Others were frustrated that there are non-pharmaceutical interventions, and others are very optimistic. Sadly, okay, there were also negative of sentiments. Specifically, many are worried, some are worried, some are hopeless, some are disappointed, sarcastic, and even angry. So for the following, we'd like to summarize everything. So the study all in all was able to identify that the non-pharmaceutical interventions such as stay at home, use of face mask, physical or social distancing, hand washing, mask testing, and isolations are the public health standards to mitigate the transmission of COVID-19 and to help flatten the curve. So the discourse that materialized followed emerging issues such as the stay-at-home orders and travel restrictions. In the Philippines, we have different types of or different levels of community quarantine. The next one is the increasing new infection cases. We are still alarmed by this up to now. There's the need for isolation facilities because when the number of cases increases, there are very few facilities to accommodate all of them or all of the cases. Policies, guidelines, and enforcements of the NBIs, numbers of recoveries and deaths, availability of test kits and centers, etc. So for the discourse fragments, it reveals several repetitive themes associated with prevention, detection of cases, treatment, and support for to the healthcare workers or the HCWs. The entanglements of diverse threads of NPIs reveal several possibilities, variations, and layers of observing health protective behaviors. The overall ideological position of the Filipino public towards the NPIs include cognitions on appeal for compliance, adherence, support, and cooperation. The discourse fragments reflect and illustrate the thoughts and feelings of the public either through simple, direct, to the point comments or through comments reinforced with nonverbal cues such as capital letters, exclamation marks, ellipses, question marks, and emojis. So for the discourse strands, these were actually emotionally charged comments that, as I've said earlier, were either positive or negative types of emotions, from being optimistic to being hopeless, no? And to the extreme being angry. So for number 8, okay, the study also looked into the sociocultural practices that materialize, which reflects the willingness of the public to support and adhere to the variations of the NPIs to prevent the risk and transmission of COVID-19 infection. So to conclude, I would like to say that the public associates NPIs with prevention, detection, and treatment, and it also revealed the different ideologies and biases that can be associated with awareness, understanding, support, and compliance, the NPIs. So the public speaking position about the NPIs resonates their continuous production of knowledge, meaning, and practice. So acceptability and willingness to adhere to the NPIs appear to be an individual choice and responsibility. Thus, the sociocultural practice of NPIs would be very different from one person to another and may be influenced by level of understanding of the ongoing realities of the pandemic, of course, their own social realities and their culture, and the culture also of the individual. So the discourse were largely driven by concern, empathy, hopelessness, disappointment, and anger. But these ideological positions are the ones that creates the stream of emerging sociocultural practices. Again, these are continuously shaped and provoked by the social realities of the COVID-19 pandemic. So with this, I would like to recommend the following. Of course, a continuous development or improvement on the communication strategies, communication approaches. Aside from the medical, I'm coming from the context of communication. So the use of pragmatic approach in risk communication is very, very important. Social mobilization initiatives may be able to bring together and mobilize people in the community. We still need to um, tap the people, tap the public, either through social networking sites, again, such as Facebook. There's also the Instagram, LinkedIn, Twitter, and many more. No, group messaging apps would be very, very helpful. There's the Hangouts, the Viber, the Slack, which can, in whatever way, help us all become a community who works together to respond to this health crisis or this health issue. So constant evaluation of the risk communication strategies used by the government, health authorities, and medical institutions will help most likely ensure accurate, honest, clear, transparent, credible, and up-to-date official information uh, to be shared to the public, can convert uncertainty and confusion into public trust and compliance. People needed something to trust on or to rely on, especially at this time. Setting up a crisis communication management team with a command center who can implement systematic, coordinated, timely, and efficient communication strategies, and hopefully facilitate risk communication on communicable diseases, not only just now, but maybe in the future. And then this ends my presentation. These are the materials that I was able to use for this presentation, aside from the whole paper that I produced, no, on this topic. And with that, I would like to again thank everyone for this opportunity. Thank you for this conference, for allowing me to share my research work. And to those who are watching, stay safe and healthy, and thank you. Have a great day and be safe. Thank you.